Hey everybody, it's Sandy and welcome back to my channel dedicated to helping you advocate for your own health one topic at a time. So today is another video in my series on supplementation, and today I want to talk about vitamin D. So if you want to hear my thoughts on that, just keep watching. So I recently did a video on vitamin C and somebody asked me if I would talk about some of the supplements that I use. I've started with the ones that I have said on my channel before that I personally recommend in light of a pandemic. And I will say again that I came out with my recommendation about 24 hours before Dr. Oz published his, and they were exactly the same, which was vitamin C, vitamin D, zinc, and elderberry. Yeah, so today let's talk about vitamin D. Now, I take vitamin D anyway, as well as vitamin C, which I talked about last time. Even if we weren't working our way through this pandemic, I would still be taking my vitamin D. Vitamin D is largely known because of its role in bone health. It helps get calcium and phosphorus into the bones. But there is a growing, and I'd say really widespread acceptance at this point that vitamin D plays a much larger role in our overall health, particularly in our immune health. Now, I'm going to link down below in the description box some citations to various articles, but in a nutshell, vitamin D does have a modulating role in our immune function. Our immune cells have the capability to synthesize vitamin D. Our immune cells react and respond to changing vitamin D levels in our blood. There have been links demonstrated between vitamin D and respiratory health. There is a lot of ongoing study now about the role in vitamin D and all kinds of health conditions. And interestingly, vitamin D deficiency is very common in autoimmune disease, which is, of course, a disease of the immune system. Now, that doesn't mean it causes autoimmune disease. It just means that there's a link there. Now, the widely known way to get vitamin D is through sun exposure. We absorb the sunlight through our skin and make vitamin D. Most people can't really get enough vitamin D this way year round. Of course, that depends what kind of climate you live in. I have read that a rule of thumb is 15 minutes of exposure over a pretty large portion of your body, front and back, 15 minutes each in the summertime would give you adequate vitamin D. Other than that, you need to supplement if you're not in a climate that allows you to do that, or if you're not able to do that every day. So I've never ceased my vitamin D supplementation and tried that to see how it would work. That said, I do like to get some sunshine on my skin, not too much. There's also the issue of balancing vitamin D versus skin cancer, and that's kind of an ongoing debate. So my view is kind of moderate on that. Now, in terms of what foods can you eat in order to get vitamin D, it's going to be the oily things. So oily fish, eggs, particularly in the yolks. I have a preference for pasture raised, so fresher eggs. Certain kinds of mushrooms are actually high in vitamin D, but my thought is, how much volume are you going to eat in the way of mushrooms? Dairy, depending on what you choose, is high in vitamin D, and apparently so is chicken. And I think right now would be the right place to insert my usual disclaimer before we discuss exactly how much vitamin D and how to get your vitamin D. Nothing that I say on this channel should be deemed a substitute for advice of your own practitioner. I'm not going to be giving any individual medical advice on this channel. So I personally, as I've already said, do choose to supplement vitamin D. I like my D to be at a level in my blood that's probably almost impossible to reach without some supplementation. There are different opinions on how much vitamin D to take and what level to achieve in the blood as ideal. There are also various health conditions that make it difficult to absorb vitamin D. So Crohn's disease would be one of those. Celiac disease would be another. Those are both autoimmune disease, so that's not a surprise. Kidney diseases, HIV/AIDS, hyperparathyroidism, anti-seizure medications, and depending on what surgeries you've had, like for example, a gastric bypass surgery, will make it difficult for the rest of your life to absorb your vitamin D, among other things. So regardless of the debate, there are some people that have to supplement their vitamin D anyway. Now, the question is how much to supplement. Now, unlike vitamin C, which I talked about in my previous video in this series, you can't just take all kinds of vitamin D without worrying about it. It can be toxic. I had said before that with vitamin C, it would really be almost impossible to hurt yourself. If you take a lot of it, you'll just get expensive urine after a while. That's not true with vitamin D. There is such a thing as too much vitamin D. It can cause some symptoms that I think are pretty broad, like vomiting, nausea, abdominal pain, increased thirst, and increased urine output. I've also read in some articles that you can get some bone pain, but I haven't read that consistently. Do you supplement? If so, what kind of supplement do you take and how much do you use? So The nice thing about vitamin D, despite the fact that you can take too much, is there is an easy blood test. You can just go get your blood drawn and find out what level you have in your blood. Now, there's a little bit of debate over the ideal level in the blood. So the Vitamin D Council states that anything between 40 and 80 is in the ideal range. Anything under 20 is deficient. The Endocrine Society uses 30 to 50 to be the normal range. So you'll see there's a little bit of overlap with the Vitamin D Society sliding upwards. I personally follow the higher end recommendation. As a general rule, in reconciling some of the different opinions on this, the general overall consensus would state that under 30 is probably getting kind of low. 50 to 80 would be in the normal range. And depending on who you read, 100 or 125 would be high. I don't recommend being too aggressive with that high end. I think most people say 100 is high. That's the high end. You don't really want to go any higher than that. Now, on top of that, there are all kinds of recommendations about what to take. So don't take more than 4,000 IU per day. On the other hand, the recommended daily allowance is a whole lot lower than that. Now, I've said before, not only in my video on vitamin C, but in other videos, that I'm not too much of a fan of the RDA. I think the RDAs, I think there's not a not so distant drumbeat coming anymore, that the RDAs are really quite low for some of these vitamins. Why have an RDA in the several hundreds when the maximum dose you're supposed to take in any given day would be 4,000 IUs? That's supposedly the very high end, and you have a blood test where you can see where you are. When I compile all those together and I see what I'm taking over the years and what my vitamin D level has been in my blood, so what my intake yields in terms of my blood level, I have become convinced that the RDA just does not even apply to me. There is no way that I could go down to taking the recommended daily allowance and still have adequate levels of vitamin D in my blood. Now, the first time I got my vitamin D tested was probably, 12 or 13 years ago. It was deficient. That's not a surprise now looking back, as I do have some autoimmune issues that I'm dealing with. The good news is that it comes right up with some supplementation. It might take a while. You have to tinker with it a little bit, but I'm going to tell you what I personally use and what I recommend if you're going to look for vitamin D supplements. So the one thing I don't recommend with almost any supplement when you can avoid it is a couple of things. One, supplements all in one pill, because you can't manipulate the values of the individual components separately, right? You're either going to take one pill or two pills. You're going to double everything, triple everything, or cut everything in half, and you might want to get more of one and less of the other and things like that. So I don't tend to do multi supplements in single pills. I also don't like chalky, hard, dry tablets. Not only are they difficult to swallow, now sometimes I don't have a choice. It seems to be the best thing, for example, in a magnesium that I take as a supplement, but I think that those pills, particularly if you're somebody who has all kinds of absorption problems, they have a lot of binders in them, and that makes them particularly difficult to absorb. So for anything where I have a choice about it, I tend to look for liquids, oils, gel caps, or oiled filled capsules, things like that. Now for vitamin D supplementation, I use an oil. And I happen to use an oil. I'll link it down below. It's Zoller's Vitamin D. You do have to be a little bit careful with it because it comes only in a 5,000 IU per drop. So at this point, I take that just 3 times a week. I'm not recommending that dose. Again, I get my vitamin D checked. At this point, I'm doing that once a year because it's been pretty stable. I try to keep mine around 80. So the higher end of that widely accepted normal, I shoot for a vitamin D level in my blood of 80. I seem to be getting it with the supplementation that I'm using. But you can just check your vitamin D, start supplementing if appropriate, check it again in a few months and see if you have to supplement more aggressively or cut back. It's really not that hard to do. You have to have a little bit of patience for it and perseverance. It's not something that's going to change overnight, so you do have to have the follow through. But back to the individual supplements. So I do prefer an oil. So when it comes to the one that I use, I just put one little drop. I let it sit under my tongue for a while, eventually swallow. If you're not going to use that particular one, I don't think it's important, by the way, to use that particular one. I would look for an oil that usually the vitamin D is in a base of either olive oil or a coconut MCT oil, really any number of oils, as we're dealing with an oil-soluble vitamin. And when I travel, I tend to use the ones that, like I said, are little oil gel caps. So they're oil-filled capsules. I actually think that if you're just kind of starting getting used to supplementing with vitamin D, it's probably better to find an oil formula that's maybe 1,000 IU's per drop. The one that I just mentioned that I'm using at the moment, which is 5,000 IU's per drop, I might mention, which is over what they say, the 4,000 per day, but I take this, 3 times a week, sort of spread out. Some people would argue that that's still not ideal. I also think that if you're just starting to experiment with supplementing vitamin D, you don't want to use something that's too highly concentrated right off the bat because you don't want to have to deal with the problem of having it have been too high. Now, in addition to that, studies have shown that it's actually more effective to take smaller doses of vitamin D more regularly than it is to spread them out and say take a huge mega dose only once a week or something like that. So that's something to keep in mind as well. I will try to find a few that I think would be appropriate and link those down below in the description box. Now, as I said before, I take several supplements daily. I have for many, many years. So when it came to me working my way through this pandemic, it didn't change a whole lot in the way of the supplements that I use. But I did make a wholehearted recommendation to maybe people who aren't supplementing, to my own family members, about having a particular emphasis on C, D, zinc. And I had said elderberry at the time. To be honest, elderberry has kind of fallen off my radar screen. I don't know why. I'd probably be better off if I kept taking it. But since I made those original recommendations, which was many months ago, there has been some study on vitamin D and its role, particularly with COVID patients. And there are some interesting findings. So, for example, in a study done on hospitalized patients with COVID-19, it was found that patients who had sufficient blood levels of vitamin D had a much lower risk of poorer outcomes. Now, in addition to that, outside of COVID, there have been studies done in general showing that vitamin D does have a role in preventing respiratory sequelae. A few examples of that being that actually low vitamin D is associated with increased risk for both viral and bacterial infections, including TB, also asthma, and even COPD. And I did read one article that was actually a review of many different studies all over the world, I think in 14 different countries and over 11,000 people. But that review of literature indicated that, in fact, supplementing vitamin D did result in a decreased risk for respiratory infections. And that proved to be true both in people who had normal levels of vitamin D and in people who were deficient. And that was the same review that showed what I mentioned just a moment ago, which is that vitamin D is more effective when it's taken more regularly and closer together rather than taking huge whopping doses like a week apart. Now, I think the most fascinating thing that I read about vitamin D, and this wasn't particularly with studying COVID, but I think it would have a particular impact on COVID, and that is that low vitamin D levels in the blood, so deficiency of vitamin D, renders someone more susceptible to something called cytokine storm. I think we've all heard about cytokine storm in COVID-19, and it's what's responsible for that massive inflammatory response that actually hurts the body almost more than it hurts the infection. The body mounts such an immune response to deal with the virus that it actually starts hurting itself. And that's what we see in some of these really severe cases of COVID-19 where people are in the intensive care unit. Well, interestingly, low vitamin D does render you more susceptible to mounting a cytokine storm. So I thought that was really fascinating, and I think that really speaks to perhaps this is a time, if you haven't already looked at your vitamin D level, that this would be a time to commit to optimizing it and talk with your provider and see what works for you. So again, I can't overstate how important it is to talk to your own individual provider, especially given the fact that it is possible to supplement yourself with too much vitamin D and have poor outcomes resulting from too much vitamin D, so you have to find the sweet spot. Again, you're going to find a range of normal. I recommend talking with your provider about whether it would be appropriate for you to supplement to the point where your blood level is at the high end of normal. I personally keep mine around 80 if I can help it. So let me know if some of you guys are doing this already. Let me know if you learned anything or if you have any other thoughts on it, questions, comments, feedback. And until next time, be well. Bye-bye.